I'm Danny Mathieu, working on research-led innovation in food and health backed by science. Today, we're comparing peptide therapy with testosterone replacement therapy, or TRT. If you've been looking into low energy, reduced libido, changes in body composition, or slower recovery, you may have seen these two options placed side by side. But they are not really two versions of the same treatment. TRT is one specific hormone treatment. Peptide therapy is a broad category covering many different medications. So the useful question is not simply which one is better, it's what is causing the symptoms and which treatment, if any, actually fits. TRT supplies testosterone directly to the body through an injection, gel, patch, capsule, or another prescribed formulation. Peptide therapy is harder to sum up because it is not one treatment. Peptides are short chains of amino acids. Different peptide medicines may affect completely different systems, including appetite, metabolism, sexual desire, or growth hormone signaling. You may hear this described as replacement versus signaling. TRT replaces testosterone. A peptide may send or imitate a biological signal. That is useful shorthand, but it does not tell you which option is safer, more effective, or more appropriate. The exact medication and the reason for using it matter far more than the label peptide. TRT may be considered when a man has relevant symptoms and consistently low testosterone levels measured under appropriate conditions. Symptoms alone are not enough. Low energy, reduced libido, low mood, difficulty concentrating, and changes in muscle mass can also be linked to poor sleep, sleep apnea, thyroid problems, anemia, depression, medication side effects, chronic illness, alcohol use, or inadequate recovery. Testosterone also varies through the day and from one blood draw to another. That is why diagnosis usually involves repeat early morning testing alongside a review of symptoms and possible underlying causes. The number is only part of the picture. TRT is most relevant when testosterone deficiency is genuinely the best explanation for what is happening. TRT is medical therapy, not a casual wellness add-on. It requires follow-up. Monitoring may include testosterone levels, blood pressure, blood count, symptoms, side effects, and prostate-related assessment where relevant. Fertility also needs to be discussed early. External testosterone can substantially suppress sperm production, so anyone who may want children in the future should raise that before treatment begins. For men with confirmed testosterone deficiency, TRT may help symptoms such as low sexual desire and may support lean body mass or bone health in selected cases. It is not intended as a general performance treatment or for men whose testosterone levels are normal. With peptide therapy, there is no useful answer until you know the name of the medication. Some peptide-based medicines have established FDA-approved uses. Others are prescribed off-label, prepared as compounded medicines, still investigational, or sold online without approval. Evidence for one peptide tells you nothing certain about another. A biological mechanism can sound impressive without producing a meaningful benefit in people, so ask what has actually been studied, which medication, for what problem, in which group of people, and what outcome improved. The word peptide alone tells you remarkably little about the strength of the evidence. The easiest way to compare TRT and peptide therapy is to start with the symptom, not the product. Low sexual desire, for example, does not reliably mean low testosterone. Sleep, stress, mood, alcohol, medication, side effects, cardiovascular health, diabetes, and relationship factors may all contribute. TRT is most relevant when sexual symptoms occur alongside consistently low testosterone. Peptide acting on a sexual desire pathway would target a different mechanism. It would not replace an assessment for testosterone deficiency or vascular erectile dysfunction. The same applies to fatigue. I want more energy is understandable but difficult to investigate. I feel exhausted by mid-afternoon most days, and it has been happening for 8 months. It gives a clinician a symptom, a pattern, and a timeline. Both treatments are marketed heavily around muscle, fat loss, and recovery. Neither replaces resistance training, enough protein, adequate sleep, and recovery time. For men who are genuinely testosterone deficient, TRT may produce modest improvements in lean and fat mass. That is different from using testosterone to enhance performance in someone whose levels are normal. For any peptide promoted for recovery or body composition, look for research on the exact product and outcome. Animal studies, laboratory findings, or changes in hormone levels are not the same as proven improvements in strength, healing, or long-term health. Mechanism is interesting, the outcome is what matters. Sometimes TRT and a particular peptide medicine may be used together, but each treatment should have its own reason for being prescribed. Someone could have confirmed testosterone deficiency that supports TRT and a separate condition for which a specific peptide medicine is appropriate. That is different from adding several treatments because they have been packaged or stacked. Starting two treatments together can also make it harder to work out which one helped or which one caused the side effect. So if both are suggested, ask why each is needed and what would happen if you started with only one. This is why blood work and a proper history should come before choosing a route. Testing may help confirm whether testosterone deficiency is present. Identify another possible explanation, establish safety markers, and create a baseline for follow-up. But more blood tests do not automatically mean better care. The value lies in choosing relevant tests and interpreting them alongside symptoms, medical history, medications, fertility plans, and your treatment goals. Before treatment begins, decide what success would look like. Which symptoms are you trying to improve? And when will you review it? Without a baseline and an agreed review point, it can be surprisingly difficult to tell whether treatment has made a meaningful difference. This monitored assessment-led approach is where LifeForce fits. LifeForce is a membership-based health and longevity program combining at-home testing, telehealth consultations, health coaching, and personalized treatment planning. You begin with your health history and blood work, and then meet with a LifeForce clinician to discuss your symptoms, goals, medical history, and the results. Depending on the assessment, the plan may include lifestyle changes, supplements, coaching, or prescription treatment when clinically appropriate. That may include TRT or selected peptide prescriptions through relevant programs, but you're not signing up with a guaranteed treatment outcome. The assessment may suggest TRT, a particular peptide medicine, another approach, further investigation, or no medication at all. LifeForce is designed to complement existing healthcare, not replace primary care or specialist services. Peptide therapy or TRT, there is no universal winner because they are not interchangeable options. Testosterone replacement therapy supplies testosterone and is most relevant when symptoms occur alongside consistently low levels and an appropriate diagnostic assessment. Peptide therapy covers many different medications, so you need to know the exact compound, why it is being offered, what evidence supports that use, and how it will be monitored. A better starting point is not choosing between the two, it's looking into what has changed, checking what else could explain your symptoms, and getting the right baseline information before treatment begins. That process may lead to TRT, a particular peptide medicine, another treatment, or no prescription at all. The useful outcome is a decision that fits the problem, not simply the product you first search for. Subscribe for more science-led conversations about health